All right, here's my audience. Kids are not included. There you go. If I get nervous, I'm sorry. It is what it is. Okay. Yeah. Have you ever been around someone whose behavior was so out there and you wondered what was wrong with them? There seems to be that one family member in the family that may have some kind of mental disorder and they can't help how they behave. I'm able to talk to you about frontal temporal dementia because I have a family member who has it and I have done some research on the subject. The purpose of my speech is to expand your knowledge about frontal temporal dementia. Today I would like to discuss with you what frontal temporal dementia is and how it affects people, research being done to find a cure, and some of my and my family's experiences with regards to dealing with my grandmother who has it. First I would like to talk about what frontal temporal dementia is and how it affects people. According to brainfacts.org, frontal temporal dementia, also known as FTD, describes a clinical symptom associated with the shrinking of the frontal and temporal anterior lobes of the brain and is originally known as epistaxis. Pretty much it's where the brain is right there. Also, according to brainfacts.org, some characteristics of FTD are behavior changes which include and are not limited to impulse or inhibited behavior, a lack of social tact, a loss of insight into behaviors of oneself and others, an increased interest in sex, neglect of personal hygiene, and compulsive behavior. According to FTA differs from other forms of dementia, such as the person may have some brain disturbances. They may remain oriented to time and place, and they may recall information about the past and present. Alzheimer's patients, on the other hand, are more rooted in the past and have more of a memory loss with present time and people and such. Secondly, I would like to talk to you about the research being done to find a cure for this disease. According to AFTD, there is no cure, and in most cases, progression can be slowed down. According to Penn Medicine, there is no curative treatment available for FTD. The current goals of treatment include treating the symptoms, which the person may be showing. For example, if the person is depressed, they need to give antidepressants. FCA mentions that there are currently no medications or treatments that can be done. Finally, I would like to talk about some of my and my family's experiences with dealing with my grandmother, who was diagnosed a few years ago. I recall the first time my grandmother met my husband on July 16, 2011. We came home on leave and we got married. We were going to go get married. My grandmother gets to my house and starts talking to my husband about when she died, she wants purple first claims. My grandmother wouldn't let the subject go for about a good 10-minute conversation. There was no concern about why we were there, the happy occasion, or anything. It was me. A couple of weeks ago, my great uncle was buried in Maryland. My mom was telling me about some of the things that my grandmother did at the funeral, at the viewing, that are not socially acceptable. For example, my grandfather helped my grandmother stand up to get a better look into the coffin, and since she was just amputated about a month and a half ago, she almost snapped the casket over. Great. My aunt lives about 4 miles from there, from their house, and has more of a first-hand experience than most of the other family members. She has helped clean my grandmother's house out because my grandmother's becoming a report. She won't let anything go. She has candles from 3 years ago. 3 years past the expiration date. In conclusion, I would like to remind you that the purpose of my speech is to expand your knowledge about frontal temporal dementia. I discussed what frontal temporal dementia was and how it affects a person, research being done to find a cure, and some of my and my family's experiences with dealing with my grandmother who had it. Again, I am qualified to be able to talk to you about frontal dementia because I have a family member who has it, and I've done some research.